This is an in-school training program presented by Nutrition 360. Today's topic, fluid restriction. Upon completing this in-service, you will number 1, understand what a fluid restriction is, number 2, know what fluids are and what foods are considered fluids, and number 3, know how to determine the amount of fluid served and how to divide the restricted amount for nursing, meals, and throughout the day or for activities. A fluid restriction means a person needs to limit the amount of fluids they should consume for health reasons. A person may be placed on a fluid restriction because they have too much fluid in their body, which makes it harder for the heart to pump with all the extra fluid and extra weight from the fluid. The amount a resident is restricted to is usually determined by the physician, who will look at factors such as weight gain, fluid retention, edema, swelling, urine output, and diagnosis such as congestive heart failure or dependency on dialysis. Monitoring of actual intake will help the physician and the interdisciplinary team determine if any adjustments in the fluid restriction need to be made. A resident can be on a fluid restriction for a few days or may be on a fluid restriction for the rest of their life. What is a fluid? A fluid is anything that is liquid at room temperature and typically has a consistency similar to water or oil. Fluids that are naturally liquid at room temperature include water, tea and coffee, milk, juice, punch or lemonade, soda pop, or alcoholic beverages. Some foods, when at room temperature, become liquids and should be counted in the fluid restriction include ice cream, sherbet, popsicles, ice, gelatin. Some foods have a high fluid content and should be counted in the fluid restriction, such as soups and stews, cream and broth-based, gravy, sauces, salad dressing. Fruits example would be melons, watermelon, pineapple, oranges. Canned fruits and liquid, wet foods such as coleslaw, cooked vegetables, and liquid. Drain as well as possible to reduce or eliminate the liquid. Also, supplements. Some supplements are part water and part solids. Glucerna 1.2 is 81% water. Nepro is 72.7% water. Make sure you read the product labels for water amounts. If uncertain, speak to a product representative. Follow your facility's policy on whether or not supplements are part of the fluid restriction, because sometimes they are not. How to determine fluid amounts served. Fluid restrictions may be ordered in milliliters, liters, or in ounces. And here you'll see the measurement equivalents and the typical restriction levels and equivalents. How to determine fluids throughout the day and what to provide. Residents need fluids to swallow most medications, so discuss with nursing how many medications the resident will need to take with fluid and how much fluid is typically taken to get the medication swallowed. Medications that mix in water, such as stool softeners, will need to have this fluid amount considered in the fluid restriction. Ask the resident what they prefer for fluid amounts during the day or activities at meals. Provide the resident as near as possible to what they request. Educate and negotiation may need to happen so the resident has a choice and still be able to follow the fluid restriction. Once it's known what the nursing fluid needs are and what the resident prefers for meals and during the day or for activities, then the fluid amounts needed for each nursing shift and for each meal and between meals or activities can be easily determined. Let's take a short quiz on fluid restrictions. Question number 1. A fluid restriction is A, when the water supply has been shut off, B, when the soda machine doesn't work, C, when someone is to consume only a certain amount of fluids each day, or D, when you run out of coffee. And the answer to question number 1, a fluid restriction is C, when someone is to consume only a certain amount of fluids each day. Question number 2. Which of the following foods is considered a fluid because it is fluid at room temperature? A, potato chips, B, hamburger, C, brownie, or D, root beer float? And the answer to question number 2, which of the following foods is considered a fluid because it is a fluid at room temperature? That would be D, root beer float. Question number 3, which items would be considered a fluid? A, milk, B, gravy, C, gelatin, or D, all of the above? And the answer to question number 3, which items would be considered a fluid? And that would be D, all of the above. Question number 4, true or false? Most often the fluid restriction order is an amount between 1800 milliliters and 2000 milliliters per 24-hour period. And the answer to question number 4 is false. A fluid restriction isn't always just 1800 or 2000, can be other amounts. Question number 5, true or false? Obtaining the resident's beverage preferences is very important to the success of the resident following the prescribed fluid restriction. And the answer to question number 5 is true. Obtaining the resident's beverage preferences is very important. Thank you for your participation in today's program. Our goal is for you to use this information in your daily work. We hope you are well served each and every day. If you would like more information about our in-service training programs or consultant dietitian services, please contact us at 1-800-761-9200 or nutritioncaresystems.com.